to show you how to do an ABG puncture today. The first thing I'm going to do is verify the order and make sure that the patient does need an ABG. I'll check and see if they had any ventilator or FiO2 changes within the last 10 minutes, 25 minutes for patients with COPD. Then I'm going to go to my patient's room. I'll clean my hands before walking in. I'll put on my gloves. I'm going to introduce myself, tell my patient who I am, that I'm a respiratory student, and that I'm going to be doing an ABG today. Then I'll check and make sure I have the correct patient, so I'll look at their armband and make sure that they can confirm their name and their birth date. The next thing I'm going to do is the Allen's test, so that's going to help me determine whether or not I can do the ABG on this arm. So for the Allen's test, I'm going to occlude both arteries and the patient will make a fist. I'll hold this until the patient, their hand is white or blanched out. Then I'm going to release the ulnar side, and if the patient's hand pinks up within 7 seconds, I can go ahead and do this side for the ABG. The next thing I'm going to do is look for a pulse in my patient. So I'll feel for a pulse and evaluate, make sure that I can go ahead and stick this patient. After that, I'm going to clear the site that I'm going to puncture. So I'll take my alcohol and I'll make sure to clean the entire area. After that, I am going to take my needle. I'm going to take the cap off of my needle. I'm going to feel for my pulse again. I'll make sure I'm holding my needle kind of like a pencil with the bevel up. All right, Mr. Jones, you're going to feel a stick. Next, I'm going to puncture my artery. Making sure to get 1 milliliter of blood. I'll put my gauze on right away. And I'm going to hold pressure for up to 5 minutes. I'll put the cap on my needle so it's secure. While I'm holding the pressure on my puncture site, I'll take the cap off and I'll put the other cap back on. I'll make sure to get all the air out of it. And I'll rock and roll to make sure that I mix everything in the tube. After about 5 minutes of holding the puncture site, I'll either tape the gauze on or evaluate, make sure they're not bleeding anymore. I'm going to take my sample, I'll label my sample, and then I'll put my sample into a bag and I'll send it down to the lab. After that, I'm going to go ahead and chart the procedure.